Discover the latest health tips, expert advice, and inspiring stories. This is the Health Channel Podcast. Your journey to better health starts now.
Did you know that 25% of all sports injuries involve the hand or wrist? On today's show, we will be joined by the medical director of hand and vice chair of research at the Miami Orthopedics and Sports Medicine Institute at Baptist Health South Florida to answer all your questions and offer you tips on how to manage those injuries in your wrist and hand and how to live with arthritis and more. That's all coming up on this episode of Ask the Doc, No Appointments Needed. Hello and welcome to Ask the Doc, No Appointment Needed, the show where the health questions you send are answered by medical professionals and doctors. Thank you so much for joining us today. I'm Kathy Buccio, and I am very pleased to be joined by Dr. Elizabeth Ouellette, Medical Director of Hand and Vice Chair of Research at the Miami Orthopedics and Sports Medicine Institute, Baptist Health South Florida. Dr. Ouellette, it is such a pleasure. Thank you so much for making time today to be here with us.
Thank you. My pleasure.
We're going to get started. We're going to jump right into these questions. And the first one comes from Alex. And he asks, I am 50-something years old and have been playing competitive sports since I was a teenager. I recently noticed a lump on my knuckle that seemed to be growing. I went to the doctor and he said it was a ganglion cyst and I should have it removed. What exactly is that? And can it be dangerous if I don't treat it? Dr. Ouellette, okay, are the ganglion cysts common and what do we know about them?
Okay, well, there's a couple of things here. Number one, they're not dangerous. So number two, we've really only been studying them histologically since 1906. So it hasn't been that long. But they also don't kill people. So a whole bunch of money has not been spent on researching them. But we do know that they are associated with any kind of inflammation from either arthritis or, a tendon being inflamed. So you can get them around your knee, around your wrist, at a knuckle, both the metacarpophalangeal knuckle, at the PIP joint knuckles, which are the second knuckle out, as well as the distal knuckles. And some of them are associated with arthritis, some with, other kinds of injuries and inflammation. But a lot of times, if you'll just treat them conservatively, a good 50 to 70% will go away with good conservative care.
Thank you, doctor. Our next question comes in from Jose, and he writes, I play pickleball 4 times a week and love playing competitive sports. Lately, my wrists and hands have been bothering me, so I went to the doctor who said it was from overuse. Is this a common injury? And what can I do to stay on the court short of taking a break? Very, very helpful video there, Dr. Ouellette. So those 4 Ps are important for all the players. So what would you say about Jose's question?
Well, so I'm going to back up to the 4 Ps and go back to a tennis coach and go back to what I recommend to people. He's correct about stretching and about practice with purpose. In other words, you need to have the right form. And if you play trying to push through against pain, you have an automatic reflex that occurs in your spinal cord that blocks you. In other words, if you're walking along the beach and step on a piece of glass, you instantly lift your foot. You did not have to think about, I'm stepping on a piece of glass and lift your foot. Your spinal cord instantly has this response, and it is to help protect you. But the problem is when you're trying to play a sport or do something like play an instrument, there's a patterning that has to occur. And if you're getting a hiccup in your stride because of something at your spinal cord, because of pain you're experiencing, you want to back up. So I tell people, practice with a purpose, but get with a coach and work up slowly but surely through an injury so that you don't hurt. You're going to focus on form, but not pain, and not no pain, no gain. Forget that. Leave that at home. You need to stop when you're having pain. You plateau right there. You just don't advance. You don't stop, but don't advance so that you have the proper form. Then the other thing he said was proper equipment, absolutely, and proper mechanics. And again, that's where getting the coach and the practicing with a purpose. So when you talk to a tennis coach or a pickleball coach, they will say it's about percentages, placement, precede, and power. In other words, you want to focus on form. It's all about the form. And the person that did that for me was Chris Everett, actually, when she described the rehab that she went through for her knee. And I said, oh, that so fits. I'm a violinist. It makes sense. It's patterning. And ever since then, I have always made sure that, athletes, whether they're elite or, amateur, or you're doing it for fun, you get with a coach that you can listen to and you will respond to, not blow off. You need to hear them. And then focus on your form and gradually work up. And by doing that, you will be able to play and play well. And so you'll get your game back. Then the question is, do you have to wear splints? Do you have other things going on? 80% of the population have a TFCC tear of some form or another. And a TFCC tear is a tear of your wrist here where your wrist kind of swings off. And you can see mine does. And now, thank goodness I don't play pickleball, but I do play violin. And I do, operate. So it's important to me, but it doesn't hurt me. And so most people don't even notice it until you begin to have weakness. Okay, so this is the other thing that the Mayo Clinic is talking about in terms of stretching, but also trying to power through your ball by doing that. And when you do that, if you have a nerve entrapment, either ulnar nerve at the elbow or median nerve at the wrist, your hand will be weaker. Your median nerve is responsible for 50% of the power in your hand. The ulnar nerve, the rest for your grip. So if those guys are weak, then your grip's going to be weak. Then you're going to be trying to power through because of the weak grip. Go get checked out to make sure you don't have a nerve entrapment that's also affecting this, as well as a wrist ligament kind of thing, which is also affecting it, now making you have to hold tighter and stronger in order to make up for ligament laxity. All those things can be made up for with splinting, anti-inflammatories, some of those kinds of things, but at least get the whole picture before you power on through if you're having troubles.
Thank you, doctor. You also said that Coco Gauff needs to be our coach then, right? That's how it's...
Well,
yes.
She might be a great coach. She's a great player. And a coaching is another skill set.
I'll take it. But this next question sort of is in vain to what you're saying right now. And this comes from Mike. And he writes, my son says he hears the clicking sounds in his wrist when he swings a bat. He says he can play through it, but is he causing himself more issues down the road? So based on what we know and what you just said in our last viewer question, can his son do more harm than good by playing through it?
Well, there's the issue. And particularly if he is in South Florida and wants to go to college in baseball and possibly go into the major leagues. And so if that's the case, you really do want to get checked out. Why it's hurting. Is it just a ligament issue? Because you know that young athletes are falling all the time, and you might have an old injury that is now manifesting itself. And even though he can play on through it, it will come to a point where he can't. Is it, in fact, maybe a hook of the hamate fracture, which is classic in baseball players, because as they go to hit with the bat then hits their hamate right here and cracks it. And so that's part of the pain. And so you at least want to know that, because then you can splint, you can do a number of things to try and calm it down. And if it doesn't work, you can always get an MRI and then see if there's anything further you want to do, potentially surgically. Because again, we're talking about a career here, possibly. If it's just casual for fun, then splint it and do some interesting things like that. But overall, I would still get that checked out, particularly if they're playing high school, wanting to go on to college, wanting to go on to major leagues.
And we just got a question from Caroline from Facebook. So here's what she wants to know. I was in a car accident and my wrist was really sore. I went to an orthopedist who said the pain and soreness was caused by arthritis, probably from an old sports injury. The weird part is I didn't have any pain or discomfort before the accident. Is that common? So, Doc, arthritis affects so many people. And this is a very interesting question from Caroline. So what do you have to say?
Well, number one, can you get arthritis from an old sports injury? Yes. And that arthritis you didn't actually really recognize. And so I have many senior amateur athletes come in and their golfing buddies or their tennis buddies say, you need to go check out that lump on your wrist. It might be cancer because, they're getting to that stage where it's important to them and they'll see a swelling here. And I can pick you out in the grocery store if you have that, because then I know that you have an old scapholunate dissociation or an old scaphoid fracture. And many times they'll come in and they're coming in for the lump, not for pain. You get the x-ray and there's terrible arthritis there, but they're still moving. They're still doing everything they want to do. And I say, are you still betting while you play golf? And they go, yes. Well, then don't stop. Don't stop and do something just because I found something on x-ray. Now, I would submit that probably if that orthopedic surgeon is telling her she has an old sports injury, it is something on that order, either a scapholunate dissociation or an old scaphoid fracture, or, that just shows an old pattern of arthritis typical of an old sports injury. Do you have to do anything about it at that point? No, but you do want to split things. And one of the things that we found looking at some testing that we did in the lab was that an awful lot of people have multiple fractures in their wrist after they've had a fall that get totally missed because it's not picked up on the x-ray. And the way to see it is with an MRI. Well, you're not going to MRI everybody that falls on their wrist, and complains of pain. So immobilize it, see if you can get it better. And if it doesn't, then it's time to begin to talk about what are the other kinds of procedures that you can do for wrist arthritis. And they're numerous. So there's a lot of, it's again, up to your physician, what they feel comfortable with. It's up to you, what you feel comfortable with. But as long as you can avoid and evade surgery at this point, better. So I tell people to get a lion's paw splint, which is the leather brace that the gymnasts use for the Olympics. And that's what allows them to do the uneven parallel bars. This will allow you to go back and do things, but protect it. And the other thing is if you have some old wrist ligament injuries, don't do flat on the floor, push-ups, downward dog, do it on your forearms. And so those are some of the interesting things. Don't do a clean, a deadlift. And don't do flies, because that also gets your wrists into a position where they're having to try to stabilize. And now you're causing more damage in the sense that you're hurting more. So let your ligaments have a chance to heal up. So don't go into those extreme, extended, and flexed positions. And most sports, you can play in a neutral kind of position and use the lion's paw to allow you for motion, that kind of thing.
Thank you. Our next question emailed in from Griffin, and he wants to know, does stress aggravate arthritis? I find when I'm stressed, my arthritis seems to flare up. So stress plays a role in many of our health issues, Dr. Ouellette. So does that also include arthritis?
It does. And so, when you're stressed, you're not sleeping as well. Are you taking your vitamins? Are you doing some of the things that you need to do to maintain and sustain your health? So, for instance, we know that cognitive decline, as you're losing your cognitive ability, you can actually support your intellectual ability by playing racket sports, by taking daily vitamins, those kinds of things, and they're very helpful. And now, if you're going out and insisting that you bench press 250 pounds, but you don't need to, it's not competitive for you. It's just you're doing it for fun. Back down on some of that weight. And again, don't do it with your wrists in hyperextension. Do it with neutral so that you're pushing up. Do neutral push-ups. Those kinds of things will protect your wrist, but still allow you to be active and do the things that help you feel better. Because we do know that exercise also increases your own natural endorphins. That's your own morphine. And so there's a reason that exercise is addictive. And I would not restrict anybody from that other than to say, please take some precautions, do some things that are protective for you.
And we just got a question from Eric, and he writes, I play a lot of golf, and lately my wrist hurts after every round. My question is, should I ice it or put on heat when I get home? My friend says I should use the rice method, but I don't know what that is. Help. So explain to our viewers, doctor, what rice is and whether it sounds like it's the right call for Eric.
Okay, so number one, rice is rest. So stop doing what you're doing. It's sort of, Henny Youngman had a joke in which a patient asked him, doctor, it hurts when I do this. And he'd swing his arm around. And Henny Youngman's response was, well, then don't do that. And so that's what rest is about. And then ice. Ice is helpful because it reduces inflammation, but sometimes heat is also helpful. So I always tell patients, do whatever feels good. And if it feels good, do it. If it doesn't, stop. Compression is sometimes helpful, and elevation. In other words, getting your hand elevated and moving your fingers. So making a fist and extending your fingers will help a great deal because that pushes the fluid out of your hand. So think of it like a water pump in terms of you moving back and forth like this, and that will help. At the same time, what's probably going on here is a TSCC tear, most likely, because a lot of golfers have a TSCC tear, particularly in their non-dominant hand. And of course, we don't ask in this particular instance, is it his left or right, and is he a lefter or righty? But we found that, particularly for golfers, that the TSCC tear occurs in the non-dominant hand because that's the weaker one, but that's the one that gets you that extra kick to get that extra 50 yards that swings out. And so I always tell people get a wrist widget, and you can get those online on Amazon, wrist widget, and you can't miss it. And it's just a splint that comes around your wrist, and just like this. And so the lump here that's your ulna sticks out, and the wrist widget goes around, and that gives you the support you need if it's a TSCC tear. And so many times that will be helpful.
Thank you, doctor. Our next question comes from Trevor, and he asks, when I play tennis, my hand hurts near my palm when I hold the racket. And when I'm done, that area is very sore. Can you tell me what this is from and if it's something I can treat, or do I have to just manage the pain? So is this a common injury? I know we talked a little bit about the form and holding the racket. So is this something that patients might ask you about? So what would we tell Trevor?
Well, for Trevor, I'm going to ask him if he ever played baseball. And does he have a hook of the hamate fracture? Because, the go-to sport when you leave playing baseball and those kinds of things many times is tennis. And so if you hurt in your palm, that has the sound of a hook of the hamate fracture. But it can also be, depending on his age, arthritis at the base of the thumb. So at the base of your thumb, right here, you can get pain, particularly when you go to hold a racket, and that will ache. So it would depend on which side of the palm it's on. Is it the ulnar side over here, which would be hook of the hamate, or more on the thumb side? And so if it's the thumb side, that's more arthritis. And I would say, again, anti-inflammatories, particularly topical, like Voltaren, which you can get over the counter in the grocery store. And then a leather splint, you can order those online. So go on to Amazon, and anything that immobilizes your thumb. So if it's on that side, that's what I would do. And if it's on the ulnar side, that's more than likely a hook of the hamate. So get a glove that is padded to be able to play with, and see if that padding doesn't resolve that pain. If it does not, then it is worth it to come in and take a look at it, because if you have an old hook of the hamate fracture, and that can literally be just from using your hand like a hammer. People pound a nail or something like that, or pound something like jamming it up against the door or whatever. That will get you a hook of the hamate sometimes. So it's worth getting that checked out if changing to a glove that gives you some padding there does not resolve that.
All right, Doc, we just got a question from Parker, and he's checking in on Instagram, and he writes, I sit in my computer all day at work, and then at night, I love playing pickleball 3 to 4 nights a week. My question is, which one is more likely to cause an overuse type injury? And is there anything I can do to ease the wear and tear on my wrist? I think this is a great question. I feel like this is a question that affects many Americans, as we all sit usually in front of a computer and you have to stay active. So what do you say to this, Doc?
Well, number one, that was the big question for a good 20, 25 years is, does computer work cause overuse? It does not. It turns out that that is related to metabolism, hormones, genetics, and anatomy. So, again, keeping yourself healthy, keeping your diet clean, and working through just being as organic or healthy living as you can, vitamins, etc. But I definitely would want you to keep playing pickleball because, as we just said, racket sports do diminish your cognitive decline. So that's key. Now, when it comes to worrying about overuse of pickleball or tennis, again, are you hurting? And if you're not hurting, well, then for you, you're not overusing it. On the other hand, if you feel like you are, it's worth it to get checked out for any nerve entrapments like carpal tunnel, ulnar nerve, any other issues with your wrist, with your instability, just to make sure those things aren't there. But in the meantime, again, you can still use a wrist widget for playing those kind of sports and or a lion's paw. The only problem with the lion's paw is it does have a kind of stiffness to it. So if you really want to be able to extend and flex your wrist, if that's part of your style, that's going to be a problem. But at the same time, would it hurt to change your style a little bit and not go to such extremes? No, it would not, because again, a lot of that power is still coming from your shoulder and your arm, not just your wrist.
One more minute. We're going to answer this one really quickly. Let's see what you can do. It's from Erin, and she joined us via email. I have heard the term sprain and strain for years, and when referring to wrist injuries, what's the difference between the two? And how can I tell which one applies to my particular injury? Are these interchangeable, Doc?
Well, I suspect that they are interchangeable in the sense that you have an injury to a ligament. Now, did it tear completely? Did it tear partially? How did it tear? And which ligaments are we talking about? Because some of them have different personalities. So, for instance, the ligament between the scaphoid and the lunate, 60% of people have a partial tear of that all their lives. And this is because we are javelin dart throwers. Also, 80% of us have TFCC tears. So, again, just realizing that that's part of being human. Now, protect it as much as you can. So no flat on the floor push-ups. You're going to do knuckle push-ups. You're going to minimize the stress and strain, yet still don't stop playing pickleball or tennis.
Thank you, Dr. Ouellette. Unfortunately, it's all the time we have for today. Thank you so much for joining us, Doctor, and what incredible insight. And thank you all for joining us and sending in some really important questions. I'm Kathy Buccio. We'll see you next time on Ask the Doc. No appointments needed. Stay safe and be well.
Thank you.
Thank you for listening to the Health Channel podcast. We hope this information has been useful. However, please remember that only your doctor can advise you about what is best for you. Do not start, modify, or suspend treatment based on anything you have heard on this podcast. Please join us again soon.